Liposuction, nose jobs, Botox. Americans aren't shy when it comes to having work done.
11 million cosmetic procedures were performed last year. As Aaron Gilchrist tells us new at 5, men make up the fastest growing group looking for the fountain of youth.
What may have once been taboo for guys isn't anymore. There has been an almost 900% increase in non-surgical cosmetic procedures among men in the past 10 years. Proof that a little nip tuck isn't as exclusive to ladies as some might think. 18 years Carl Slayton has had a thriving catering business in Richmond, and every day he comes eye to eye with clients.
Before, I always felt like I had something in my eyes. The skin was heavy over my eyes, and he just went in there and cut out, you know, a big chunk, and they feel much lighter.
It makes a pretty big change.
He is plastic surgeon Gregory Lynam, who worked on Carl 7 months ago.
He didn't like the position of his upper eyelids. He felt they were a little low, and he didn't like the excess skin laterally or superiorly above his eye that made him look and feel somewhat tired.
A little nip tuck is becoming more popular among men. Just turn on your TV.
Let's do a little bit of Botox.
They were afraid of the stigma of being maybe too feminine. Maybe it wasn't a masculine thing to have cosmetic surgery. It was something that just women did. But now men really, I think, are really embracing it.
And the numbers prove it. There were more than 1 million cosmetic procedures performed on men last year. At the top of the surgery list, liposuction, eyelid lifts, and nose jobs. Non-surgical work included Botox, hair removal, and facial resurfacing. Dr. Lynam says for men, it is about vanity and more.
They want to look better. They want to be more attractive to the opposite sex. I also think there's a larger component for the older men of wanting to stay competitive in the marketplace, competitive in their job.
Some guys want to open their eyes and shave a few years off their faces, but Dr. Lynam says too much can be too feminizing for a man. An idea Carl accepts, but he hasn't ruled out another touch-up down the road.
You have to do what you have to do to kind of turn the clock back.
Cosmetic surgery is not for everyone. There are risks involved, especially for people with health problems. A good cosmetic surgeon will do a consultation with you and possibly even your regular doctor before performing most procedures. I'm Aaron Gilchrist, NBC 12 News.
Expect to pay more.